Scenario 1. Neonatal respiratory distress. A term newborn presents with severe respiratory distress shortly after birth. Physical examination reveals subcostal retractions, nasal flaring, and grunting. Oxygen saturation is 85% on room air. What is the most likely diagnosis? A. Transient tachypnea of the newborn, TTN. B. Meconium aspiration syndrome, MAS. C. Respiratory distress syndrome, RDS. D. Pneumonia. E. Congenital diaphragmatic hernia, CDH. Answer. E. Congenital diaphragmatic hernia, CDH. Explanation. CDH is a congenital defect in the diaphragm that allows abdominal organs to herniate into the chest cavity, leading to severe respiratory distress. It often presents with subcostal retractions, nasal flaring, and grunting, and decreased oxygen saturation. TTN, MAS, RDS, and pneumonia may present with respiratory distress but have different clinical characteristics. Scenario 2. Febrile seizure. A 14-month-old child presents with a fever and a generalized tonic-clonic seizure lasting 2 minutes. The child has no prior history of seizures. What is the most appropriate management? A. Immediate lumbar puncture. B. Initiation of antiepileptic medication. C. Observation and evaluation for the source of fever. D. Discharge home with parental education. E. Admission for continuous EEG monitoring. Answer. C. Observation and evaluation for the source of fever. Explanation. Febrile seizures are common in young children and are typically self-limiting. The priority is to identify and manage the underlying cause of the fever. Lumbar puncture, antiepileptic medication, and continuous EEG monitoring are not indicated for a simple febrile seizure in a child with no concerning features. Scenario 3. Pediatric appendicitis. A 10-year-old child presents with right lower quadrant abdominal pain, fever, and rebound tenderness. Laboratory tests show an elevated white blood cell count and neutrophil predominance. What is the most appropriate next step? A. Perform an abdominal ultrasound. B. Order a CT scan of the abdomen and pelvis. C. Administer intravenous antibiotics and observe. D. Proceed with immediate appendectomy. E. Consult a gastroenterologist for further evaluation. Answer. D. Proceed with immediate appendectomy. Explanation. The clinical presentation is consistent with acute appendicitis, and immediate appendectomy is the standard of care in this scenario. Imaging studies may be obtained preoperatively for confirmation, but surgery is the definitive treatment. Scenario 4. Pediatric abdominal mass. A 6-year-old child presents with an abdominal mass, weight loss, and pain. Imaging shows a large abdominal tumor. Biopsy reveals small round blue cell tumors. What is the most likely diagnosis? A. Neuroblastoma. B. Wilms tumor. C. Rhabdomyosarcoma. D. Ewing sarcoma. E. Hepatoblastoma. Answer. C. Rhabdomyosarcoma. Explanation. Rhabdomyosarcoma is a malignant tumor of striated muscle origin commonly presenting as an abdominal mass in children. The small round blue cell appearance on biopsy is characteristic. Neuroblastoma, Wilms tumor, Ewing sarcoma, and hepatoblastoma have different histopathological features. Scenario 5. Pediatric inflammatory bowel disease, IBD. A 14-year-old adolescent presents with chronic diarrhea, abdominal pain, weight loss, and bloody stools. Upper endoscopy and colonoscopy reveal skip lesions, cobblestone mucosa, and granulomas on biopsy. What is the most likely diagnosis? A. Irritable bowel syndrome, IBS. B. Celiac disease. C. Crohn's disease. D. Ulcerative colitis. E. Infectious gastroenteritis. Answer. C. Crohn's disease. Explanation. The clinical presentation, endoscopic findings, and presence of granulomas on biopsy are consistent with Crohn's disease, a type of IBD. Ulcerative colitis typically involves continuous inflammation of the colon, while Crohn's disease can affect any part of the gastrointestinal tract. Scenario 6. Pediatric cardiac murmur. A 4-year-old child presents for a routine checkup. On physical examination, you hear a grade 3/6 systolic ejection murmur at the upper left sternal border that radiates to the neck. There are no other abnormalities on examination. What is the most likely diagnosis? A. Innocent, physiologic murmur. B. Ventricular septal defect, VSD. C. Aortic stenosis. D. Patent ductus arteriosus, PDA. E. Coarctation of the aorta. Answer. A. Innocent, physiologic murmur. Explanation. Innocent murmurs are common in children and are typically benign without any underlying cardiac pathology. They often occur at the upper left sternal border and are systolic ejection murmurs. Clinical context and the absence of other abnormalities are crucial in distinguishing them from pathological murmurs. Scenario 7. Pediatric head injury. A 7-year-old child falls from a tree and hits their head. The child is briefly unconscious but quickly regains consciousness and is now alert and responsive. There is no vomiting, seizures, or signs of focal neurologic deficit. What is the most appropriate initial management? A. Immediate computed tomography, CORT, of the head. B. Observation in the emergency department for 4 hours. C. Administration of high-dose corticosteroids. D. Surgical intervention for intracranial hemorrhage. E. Discharge home with close follow-up. Answer. B. Observation in the emergency department for 4 hours. Explanation. This child presents with a mild traumatic brain injury, concussion. Initial observation is appropriate to monitor for any signs of worsening, and further imaging or interventions can be guided by clinical changes. Scenario 8. Pediatric inborn error of metabolism. A 2-day-old neonate presents with poor feeding, vomiting, and lethargy. Physical examination reveals a sweaty feet odor. Laboratory tests show metabolic acidosis and hyperammonemia. What is the most likely diagnosis? A. Cystic fibrosis. B. Galactosemia. C. Maple syrup urine disease, MSUD. D. Phenylketonuria, PKU. E. Wilson disease. Answer. C. Maple syrup urine disease, MSUD. Explanation. MSUD is an inborn error of metabolism characterized by an inability to metabolize branched-chain amino acids, resulting in elevated levels of leucine, isoleucine, and valine. The sweaty feet odor is a characteristic finding. It can lead to metabolic acidosis and hyperammonemia. Scenario 9. Pediatric inguinal hernia. A 3-month-old male infant is brought to the clinic by his parents due to a painless bulge in the right groin that appeared during crying episodes. The bulge disappears when the infant is calm. What is the most likely diagnosis? A. Inguinal hernia. B. Hydrocele. C. Undescended testicle, cryptorchidism. D. Testicular torsion. E. Epididymitis. Answer. A. Inguinal hernia. Explanation. Inguinal hernias are common in infants and may present as a painless bulge in the groin that is more noticeable during crying or straining. The bulge typically disappears when the infant is calm. Surgical repair is the definitive treatment. Scenario 10. Pediatric fracture assessment. A 12-year-old child presents with a painful, swollen forearm after falling from a bike. Examination reveals tenderness over the distal radius with deformity. X-rays confirm a fracture with dorsal displacement. What is the most appropriate management? A. Closed reduction and cast immobilization. B. Open reduction and internal fixation. C. Observation without intervention. D. Application of a splint and outpatient follow-up. E. Immediate referral to a pediatric orthopedic surgeon. Answer. A. Closed reduction and cast immobilization. Explanation. Closed reduction and cast immobilization are the standard initial treatment for most pediatric forearm fractures. This approach is effective in correcting the deformity and allowing for proper healing. Surgery, open reduction and internal fixation, is usually reserved for more complex fractures or cases where closed reduction is unsuccessful.